On the pandemic, cases continue to surge in Canada's north. In fact, health officials say they have added 21 new COVID cases and 2 communities to the latest outbreak in the Northwest Territories. Most are still in the Satu region, where the outbreak began more than a week ago. The Canadian Red Cross and the Canadian Rangers have been given the green light to provide support in some hard-hit areas. But territorial officials are still looking to Ottawa for more help. And for more, let's bring in Juanita Taylor.
Another community with active COVID-19 cases has been put on the list by the territorial government.
Fort Providence, a pit stop for travelers between the N.W.T and Alberta borders. As of yesterday, 4 affected communities are getting some much-needed assistance. The federal government is activating the Canadian Rangers to help out with things like delivering food and water. It's also activating 5 Canadian Red Cross nurses. The territory's health minister says she's satisfied with the response so far, but she's asking for more.
Ask the federal government for a comprehensive response to our capacity questions here. And another possibility is for them to be a broker of healthcare staff from across the country. We haven't got any commitment on that yet, but that potentially would bring us staff from areas that are not as hard hit as we are. And they could be doing anything from nursing to logistics to lab analysis. It would be very wide-ranging.
Green says the territory doesn't seem to be on top of the COVID situation yet.
I'm very worried about it. I'm worried that we have, as you say, communities with limited healthcare system. We are relying on community health representatives in some cases to be the first point of contact. I'm concerned about the 7,000 children who haven't been vaccinated because they're not eligible for a vaccine.
Green says the health department is also working to meet the territory-wide nursing shortage. Appointments have been moved to virtual care at 2 health clinics in Yellowknife, and it's put in calls to people with nursing credentials no longer working as nurses to help fill vacancies and relieve some of the pressure. Juanita Taylor, CBC News, Yellowknife.